Okay, so today we're going to learn about the types of arthritis. There's a few, in case you didn't know, there's not just osteoarthritis or rheumatoid, there's a few others. We're going to learn about different types of treatments, management strategies, and then at the very end, some gentle exercises that you can do at home that don't really require any equipment. But should you want something that's more exercise based in like a fitness center, that's something that, we could actually work towards in a more clinical setting. And hopefully help you to navigate things with John, the trainer over at the fitness center, because we are familiar with some of the exercise equipment over there and we can direct you to what's safe for your particular condition. And that'll be at the very end. So the types of arthritis, in case you didn't know, there's more than one. There's osteoarthritis, which is what most of us have. There's gout. There's rheumatoid arthritis, which is probably the second contender that a lot of people have. Spondyloarthritis, and then there's juvenile idiopathic arthritis. For the talk today, I'm mostly going to be referring to arthritis in terms of osteoarthritis and rheumatoid arthritis. They're managed very similar. Spondyloarthritis also kind of squeezes in there, but that's usually just kind of more along the lines of treatment that we can do. Same thing with just regular osteoarthritis. So let me go back a page. So osteoarthritis is the kind that we get, it's the wear and tear arthritis, the arthritis we get for just being human and going around the sun each year. Then there's gout, which is more of a chemical imbalance. You can get gouty crystals, infections, exacerbations, and that's usually detected through lab testing. And you have to change diet, unfortunately, usually for that. Rheumatoid arthritis is more of an autoimmune disease. So that's something that your body starts to attack the joints and starts to erode the cartilage. That's the autoimmune. So usually that's medically helped with medications and exercises. Spondyloarthritis is usually kind of a self-fusing, another autoimmune disease, usually affecting the spine. So slowly your body attacks itself and actually kind of fuses your spine. And then juvenile idiopathic arthritis is another lovely little autoimmune disorder that usually attacks kids in their adolescence. So not really most of you guys, I think. Not even me. I'm a little too old for that. So we'll just skip over that one completely. But for the most part, all arthritis, every single one of them, it's an inflammatory process. So they're all inflammatory in nature. So that's the biggest thing that we feel. It can affect every age. As you saw, we have juvenile all the way up to the 100-year-olds and beyond. I myself am 42 and I have arthritis. I was diagnosed with arthritis in my foot when I was 24, and then I was diagnosed when I was 38 in my back. So it doesn't matter if you're old or young. It gets us all eventually, and it's just a process of aging. It's one of the things that gets a bad rap because we think, oh, arthritis is only for old people, but it's not. You can be young like me and get it, unfortunately, and then you get to manage it. It's not the end of the world. It's just a process of aging. And it affects all activity levels too. So I see people like myself, I was a competitive gymnast. That's probably how you guys figured I got my arthritis, and you're right. I had some pretty bad injuries and it led to arthritis, which is okay. Other people, they're great couch potatoes. They haven't moved. So the joint fluid doesn't bathe the joint and they get arthritis. And then there's some of us that just have lovely genetics from our parents and they just gave you not the greatest connective tissue and it erodes faster. So I kind of liken arthritis to a car tire. You can have really good tire treads from your parents, drive it really, really good and preserve yourself and have those tires for a long time. You can also get the stock tires that they give you at the dealership. And you can do burnouts and you can drive and you can go really hard and you can wear out your treads a little faster than the other. And so that's kind of how I see arthritis. It's just the covering on the joint, the cartilage around the joint that keeps things moving and soft and cushioned. And everybody's a little bit different. Some people, like I said, I've got the good warranty, good stock, and some people just inherit not the greatest cartilage. But its main purpose is to cushion the joints. So in between each joint, you have disc in your back that look like this. Each one of these little spots right here is cartilage. Nice cushion. As we get older, they wear down. There's less cushion, less shock absorption. Same thing within the knee. Nice and cushioned here. As it wears down, less shock absorption. And in the shoulder too, but it's a lot harder to see in the shoulder because the shoulder has the muscles on it. Okay. So the other main thing that cartilage does is it keeps the pain receptors quiet. So cartilage doesn't have a whole lot of nociceptors, as we call it. Those are the ones, the receptors that are important in telling your brain there's something that isn't right. And cartilage does a good job of covering that and keeping those quiet over the bone. Bone has a lot of nociceptors. And so when you slowly erode and you get those tire treads really, really thin, all of a sudden you start to hurt. And that's what cartilage also protects. So we have two things, shock absorbing and keeping those pain receptors nice and quiet. And when things are going great, you don't notice anything. You just kind of keep walking, keep being active, and it's totally fine. So this is a nice little diagram of arthritis. So you can see the top part up there, the number 1 of the hand, the blue part's cartilage, looks really good. Number 2, it starts to degrade a little bit of inflammation. That's the red joint lining around it. 3, the cartilage is wearing even more. 4, it's starting to get scar tissue in there. And then 5, it slowly fuses. So that's kind of the very long process that happens with cartilage. And it can happen in any joint. This just happened to be a good one of the hand. It can happen in the hip, shoulder, knee. Okay. So symptoms of arthritis, most people start to notice stiffness. That's the biggest thing. Stiffness in the morning and after sitting down for a while. So the first few steps are a little achy, or after you've watched a movie for 2 or 3 hours, you think, oh, there it is. And then after you've walked for a few, it usually kind of eases up. A little worse in the winter time because it's a little colder, not as bad in the summer, but because we tend to have nice cool mornings, it could still be bad in the morning and the summers too. Some people will notice after a nice hot shower, it's not as bad. Again, getting that fluid moving and warmth helps a little bit. The other thing a lot of people will notice is a little bit of swelling or a little bit of redness around the joint. It doesn't have to be that it's a balloon, like a big old grapefruit attached to your elbow or anything if you have elbow arthritis, but it might just be a little bit inflamed. Very, very small. You just don't see the same dimples on your knee as you do on the other side. And that's just the inflammatory process talking. Usually coming on a little bit more as you exercise or you walk more or you're being more active. Second half of the day. In the morning, it looks pretty good. Second half of the day, the kneecap's not as refined looking. And that's pretty typical. That warm red skin I talked about, that little bit of erythemic, again, an inflammatory response, kind of like a bug bite. And then also some people notice that, I just don't feel as strong in that knee as I used to. That leg feels weak since it's stiff and achy in the morning. Usually it's because you're not using it because it hurts, so you use it less. Your muscles are only going to stay as strong as they need to be for what you're doing. The other thing is that pain is a natural strength inhibitor. So when your brain detects pain, it automatically is going to put a little less effort into those muscles, so it inhibits your strength a little bit. It's a normal response. It's a protection thing. So it's not bad. It's just part of the normal response to pain. So who gets arthritis? Pretty much everybody at some point, as I mentioned earlier. You can exercise too much. You can exercise too little. People that have had trauma, that would have been me. And then again, that genetic condition. It's kind of just a normal aging condition. Arthritis gets a bad rap, but it's really, really normal and it's very manageable. All ages, all activity levels. all sharing the aging process. We're all going around the sun each year. We're all going to eventually get it, unfortunately. But the best thing is that research shows that regular exercise and activity manages arthritis, and it's one of the most important things to reduce arthritis. So that's where I come in as a physical therapist. So things that you probably have already dabbled in that I usually help with are self-pacing activities. So in physical therapy, we usually, through your intake, ask you what's uncomfortable, how can we change it? Can we modify the body mechanics? Can we have you pace it to where you're doing your gardening in 3 chunks for the day instead of all in one setting? Those are self-pacing things. Some people have figured that out on their own, which is great. But a lot of us need a little bit of help to think, oh, maybe I could break that into 2 parts. Or maybe I could put the laundry basket up higher so I'm not always bending down. Little things like that for self-pacing. Another common things a lot of patients ask me about are injections. There's a whole variety of injections now, ranging from stem cells, hyaluronic acid, steroids. So that's not really my territory, but I will touch on them a little bit. So steroids, people will get those sometimes. They just basically are reducing that inflammatory process, which is great. It doesn't put the cartilage back. It doesn't stop the process. All it's doing is saying, hey, let's put a lot of effort into getting that inflammation down so that you can move again. And it's great because then you can strengthen, you can walk, you can stay active. And people will go about doing that every a few times a year, and it's absolutely wonderful until at some point in time, it doesn't work anymore. So at some point in time, the cartilage and everything continues to degrade and it has diminishing returns. And that's usually when the doctor, an orthopedic physician, starts to mention to you, it might be time for that replacement. So that's one option. The other option that's pretty popular is hyaluronic acid. It's another injection. What that particular injection does is if you have enough actual cartilage cells, it helps to actually produce more fluid in the synovium. So it tells those cartilage cells produce more basically WD-40 in the joint, make it move a little smoother. It takes a few months for it to be effective, but that's what it's doing. It's encouraging those cartilage cells that you have left to give it more axle grease, okay? And again, those work for a while, but at some point in time, your cartilage continues to erode, and eventually, again, you're having that same conversation with the doctor. Is it time for that replacement? The other thing that's still being looked into is stem cells. Stem cells has research, but they still haven't found the exact perfect amount. But the theory behind it is take the stem cells. Hopefully those stem cells are going to help to regenerate cartilage and give you a little bit more time as well. But again, there's not as much data on that, so it's not usually covered by insurance. And a lot of people don't do it because it's not cheap. I think it's like $2,000 for maybe it to help. But down the road, you're still eroding the cartilage you have, and you're probably going to end up needing to have a joint replacement at some point in time. So you can also use over-the-counter anti-inflammatories, which again, since arthritis, all of them are an inflammatory nature. Over-the-counter anti-inflammatories are very effective. You can use whichever one your body's enjoyed in the past, and if it helps, it helps. And that's one of the things that you can do as long as you follow the bottle. Some say 2 tablets every 4 to 6. Some say, extra strength 1 tablet every 12 hours. So just follow the bottle is all I can really advise on that. Sometimes physicians will give you actual prescription anti-inflammatories. So those are usually just a higher end dose. There's all sorts of different ones, Celebrex, Vioxx, there's so many of them now. There's even creams, Voltaren cream. And then just over the higher dose of the Motrins and stuff like that. Again, those you have to go through the doctor, which again, you're gonna follow whatever their regimen is. The thing I like the best is physical therapy and exercise. So that's what we're going to talk a little bit more about now. So physical therapy and exercise, we can kind of break it into a few different categories for management. So we can do some stretching, usually home type plans and exercises like yoga. We can encourage things that are more aerobic in nature, like walking, cycling, swimming, water aerobics, elliptical at the fitness center if you like. And stationary cycling at the fitness center are great. Strength training, weights, rubber bands, any type of resistance training, whether it's at the fitness center or at home, even doing water bottles for weights can be very effective. And then also water resistance. So you can use water aerobics. The faster you try and move your body in the water, more turbulence equals more resistance. And there you go, you have a resistance exercise. So if you really like the water, there's ways to do it in the water as well. And then balance is very important for all conditions, but Tai Chi is one of the things that I know out here, they have a Tai Chi club. If you haven't checked it out, it might be something for your balance to do. And I believe there's a few balance classes that also happen in this center, but I can't remember what day. I've just heard about it from my patients. So balance training is also important. And physical therapy uses a little bit of all of these when you come and see a physical therapist to get you set with something. So the benefits of exercise is it helps to regain that lost motion. So our bodies are only going to do what we're asking them. So if we're sitting still all day in a chair, we're going to get stuck in this position. If we actually ask it to move and do some stretching over time, there will be some flexibility gains. That's kind of one of the coolest things about the body is that it is a living structure and it will change with outside forces on it. So it also, when you exercise, you have a decreased sensation of stiffness because you're actually moving the joint, you're moving that synovial fluid. You're making that all of the joint fluid, which is like that WD-40 I mentioned, you're moving it. So it's actually working. So it's very important to keep moving. Our bodies were designed to move, and that reduces that feeling of stiffness. And then also strengthening muscles around the affected joint helps suspend the joint and keep it more protected. So if I'm standing here, I have the force of gravity pushing down on my spine. If I don't have a strong core, that force of gravity compresses my spine more. And then that makes my disc get squished more. If I use my core muscles and I pull myself up, I extend a little bit and I suspend the joint better. And that takes some of the stress off of the disc. That can happen at the knee and the hip and the shoulder as well. So if you use the muscles around the area and you strengthen them, they help to sustain that suspension that should happen. Because unfortunately, or fortunately, gravity is a constant force. It's always going to be on us, which is a good thing. So we don't fly off into space, but it does compress our joints, unfortunately. So all of these benefits can be pretty obvious, but the coolest thing is that there's study after study after study showing that exercise can be just as effective as medication, which is, I think, pretty cool because we don't have as much side effects. You don't have the GI upset. So overcoming some of the barriers we're going to talk about next. A lot of people want to exercise, but they're afraid it's going to hurt. So there's that fear of pain. So what we want to do is remind people that movement actually does help reduce pain. No movement at all actually will increase pain. Remember back to that synovial fluid, moving the joint actually bathes the joint in that fluid and it stays more flexible. So we want to do gentle movements, and I'll show you a few of them at the end. People are always afraid, well, am I going to make it worse? I'm going to damage it more if I do stuff. Studies show time and time again that the exercises usually don't damage it more. Again, they move that joint fluid. They keep the muscle strong. They help suspend the joint and preserve function. So that studies show movement still is good. Exercises are good. You're not going to do more damage. You're actually going to keep the joint healthier longer. Afraid that it's going to cause a flare-up. We all have this fear that there's going to be a major pain increase if all of a sudden I start exercising. Well, there might be a little bit, but what we want to encourage you not to stop your exercise, but maybe modify it. So maybe not do as high of a weight or not walk as far or long. Try and modify it, go slower. I tell patients all the time, if it hurts to go all the way, go halfway. You're still using the muscle. And those are things that you can modify. So usually reducing your speed is important. Reducing, if that doesn't help, then reduce the arc. So don't go as far if it's an exercise. Go within your pain-free range. And if both of those don't help, then reduce the weight. And if all three of those don't help, that's when you need to come see a physical therapist to figure out what exercise we can then alter to still get that muscle without irritating your joint, okay? And the other lovely fear that people have is that it's going to fatigue you, and then you won't have the energy to do stuff. Well, as I mentioned earlier, our bodies are a living structure, so they're going to adapt to the demands we put on them. So at first, you might feel a little more tired. You might sleep really well that night for the first week or two, but then eventually your metabolism actually increases and your energy actually goes up because you've asked it to do that a few times. And so that's kind of neat too, is that you will actually increase your energy by exercising because you've asked your body to make an adapted metabolism in order to actually sustain your new exercise. So it's actually a really good thing to move and exercise. And I'm sure the fitness group is all excited about this. You're going to get a bunch of new members. But again, it's over time. So you might feel tired at first, but eventually you will get stronger and you'll have a little bit more energy, a little more pep in your step, which is kind of cool. So the other thing when you're having some discomfort is how do we kind of combat some of these barriers that we just talked about? There's a few things you can do at home. Some of you guys might have figured this out. Heat is great. I absolutely love my heated seats in the car. They are how I get to work in the morning. Gets that back real nice and warm. And I have about a 15-20 minute drive, so it's perfect. If you're not going to work still like me, put a heating pad on, take a hot shower. If you have a hot tub, use a hot tub. There's lots of options for heat. Put on there for about 20 minutes is that therapeutic window. It doesn't mean that more or less is better. It's just that 20 is kind of the standard that's just shown to be very effective. But if you want to sit through a movie with a hot pack on for 2 hours, by golly, do it. If it makes it to where you can get out of the chair afterwards easier, do it. It's absolutely fine. Or sewing or whatnot. After activity, if you're sore, that's where ice comes in. So going back to the beginning, when I mentioned that all arthritises are inflammatory in nature, the best and easiest thing that has the least amount of side effects is ice. So if your knee hurts after you went golfing or playing bocce ball, put an ice pack on for 10 minutes. It's amazingly quick and easy. You don't have to worry about any GI upset with like anti-inflammatory pills. And it's topical, it's right to the spot. So wherever you're having that ache, try an ice pack for 10 minutes. It's pretty impressive that it helps so much. The other thing that people can use is some over-the-counter devices like a TENS unit. So those are little tiny devices that have 4 pads and that actually kind of almost look like this little pack here I have here. But you would put it around the area, turn it on, and it gives a little bit of a vibration buzz. That buzz over about a 20-minute to 30-minute window actually starts to confuse your pain receptors and to release an endorphin release to help with pain management. Doesn't give you back any of the cartilage, but it can help with reducing pain. They were designed to be able to be used while you do something. So if you wanted to and you only could stand up 5 or 10 minutes and you needed to get through it, 15 minutes of dishwashing, you could put the unit on and try and get through that 15 minutes. It's just another tool. They have a lot of them out there now on Amazon, and I think I saw a few in CVS or Walgreens, I can't remember. But they range anywhere between $30 and $40, so they're pretty affordable. If you had other questions about that, I can always answer at the end. So these are all management options. None of them give you back the cartilage. So heating before, icing after, TENS, injections, all of that doesn't give you back the cartilage, unfortunately, but they're all really good management tools, and they can be something that can prolong your mobility and activity, okay? So exercises that I wanted to go over, I kind of clumped it into my handouts for spine, arms, and legs. And the arms kind of also does a little bit of the neck. It's kind of in between. So this is just part of the handout in the back. There's actually more exercises. But the first exercise, lying on your bed, not like these people lying on the floor because they're crazy. You're gonna rock your knees side to side. And what this does is it actually gently moves that synovial fluid, rocking your knees side to side. And it's very soft, it's not impactful, and it also increases your flexibility because you're stretching those ligaments out. So that's the first one. The second one is just bringing your knee up to your chest, and you can do that and hold for about 30 seconds. That helps to round your back, again, stretching some of those ligaments and moving that joint fluid in a very controlled, gentle fashion. And then after you do both single knees, trying to bring both knees up to your chest and really round. And so those are the very gentle stretches that are low impact, really good for flexibility of the back. The last one on this first page is abdominal bracing. So a lot of people think they need to do sit-ups. Sit-ups, not so great for a lot of people because we end up wrenching our necks to do it. So a better way is actually just learning how to abdominally brace when you're lying down and holding it for about 10 seconds. Those are the muscles, your transverse abdominis, that actually help support your spine. When they aren't working, this happens. And then there's compression back here. So what we want to do is make sure that the transverse abdominis, which is that abdominal bracing muscle, is helping to suspend the spine, because those fibers actually go sideways and they look like a corset, and that's what they do. They help support the spine. The second page has a few more exercises on it, but I couldn't figure actually out how to fit it on my slideshow. So in the back, there's more. And if we run out, it sounds as though they're going to have to post them on the website because I'm getting the signal that they're all out. Okay, so we're going to move on to shoulders, which has some neck stuff in it as well. So some of us start to notice after we've been sitting at the computer or reading a book or doing puzzles or scrapbooking that our neck gets a little sore. So one of the really nice exercises to do is to remind yourself to get out of this posture and get into this posture just by doing some shoulder pinches. So shoulder pinches are easy. The other one is backward shoulder rolls. So everything in the world that we see today is very front facing. We have our tablets, we have our books, we have our phones, which are lovely. All of that's very forward, even down to eating. We kind of lean forward because not a lot of our moms are still nagging at us to sit up with good posture. So around 1 or 2, 3 times a day, maybe attach it to your meals, do some shoulder rolls backwards. We got the forward part really good throughout society and all of our activities, but the backward stuff and the pinching we forget about. So when you do it, keep your chin up and your collarbones up as you pinch back. Don't look down because look, I'm not helping the neck at all with this. And I swear the ground's gonna stay there. It's been there for a while. It's not going anywhere. So chin up, collarbones up. If you have to, think about military posture or ballerina posture. Both of those are things that you can kind of assimilate as you do these little pinch backs. Now, after you've sat for a bit and this muscle feels a little bit sore, or you've been mousing for a little shirt pocket stretch can be very effective to help kind of limber that up. So just looking over, I also call it the deodorant check because it kind of looks as though that's what you're doing. But you like basically point your nose into your armpit, give a little bit of a nod down, and you're going to feel a stretch right through here. Hold that stretch for about 60 seconds, and then you can do the other side. Stretches need to be held for about 60 seconds, so do try to hold it for that long. If you can't physically hold the stretch because it's too uncomfortable for 60 seconds, then you're pushing too hard and you're not doing yourself any good. So you should be able to melt into the stretch, hold it for 60 seconds, and if you can't, then don't crank so hard because it's not worth it. These next two exercises are shoulder exercises that are designed to help strengthen the shoulder. And so you can actually go in a few different directions. I'll go through all 6 of them. So all you need at home is a wall and a folded towel. So a folded towel just protects your knuckles to keep the wall nice and soft. So basically this first one, putting the hand and a towel, elbow by your side and trying to push in. So if the wall wasn't there, this would be the motion. You're just trying to push against the wall. These are all called isometrics. The opposite is going onto the other side and pushing out. So if the wall wasn't there, that would be the motion. You can also try and push forward into the wall, have the wall behind you, try and push back, push to the side, and then put a little that little rolled up towel in between your elbow and squeeze in. This gets all 6 directions of the shoulder that the shoulder can do. It's not going to cause it to be painful because you're not pushing it into a position that it doesn't like, but you're asking those muscles that help keep the shoulder girdle strong to do something in a very safe fashion. So keeping that close to your elbow and doing these little pushes can be really a great start before you get over the fitness center and start doing bicep curls and water bottle lifts or 2-pound lifts. This kind of gets you ready for that if you've never done any shoulder exercises. And so the handout has the remaining 4 on there that they'll link on the website. The last one is leg exercises. So leg exercises, again, you can do these at home. You don't need to go anywhere to start, but eventually maybe that gets too easy and you need to go to the fitness center. So these exercises, you don't necessarily need to go buy a ball, but you again can roll up a bath towel, put it between your knees, squeeze your knees and try and lift your butt up. You're getting 2 muscle groups with this. You're getting your inner thigh and you're getting your back muscles here. Those muscles are important to stabilize your pelvic girdle when you're walking, and they relieve some of the stress on the hip and knee. So by doing this exercise, you're helping 2 body parts, your hip and your knee. The next one, I think of it as the Jane Fonda workout because it's a good one. And the leverage when you're sideways trying to lift your leg up is very effective. It's just on your side, lift the leg up nice and slow and down. It works again, the muscle right here. When this muscle is not strong enough, what ends up happening is our pelvis gets more like this when we walk, and I'm really exaggerating it, but that puts more stress on the hip joint, and then that causes more pain, and your arthritis is more noticed. When your abductors, your muscles right here, do a better job of holding you up, and they're stronger, you don't have that pinch from your legs going in when you walk. So it reduces your hip pain when you have hip arthritis, which is really cool. The circles is a variation on it. So basically you're going to lift the leg up and do circles 15 and then 15. Again, to strengthen that muscle right there. So you have less of this pinching when you're walking, which is going to be less painful for your hips when you're walking. Heel lifts are another good one. That muscle, that calf muscle, it crosses the knee joint. It's an accessory knee bender, but it's also the muscle that propels us forward when we're walking. So it's very important. And easiest way to do that is while you're waiting for the microwave to go, do your 20 or 30 and be done. It's a really fast one. You can use a table to help you balance. If you want to work on your balance without it, you can do it without. But it's a nice, easy one to do that you can kind of fit in anywhere in the kitchen or the bathroom. There's a few more leg exercises that I also put on the handout, but unfortunately I couldn't fit them on the screen. But if you guys have any questions, I can pull those up. Actually, I might be able to pull those up. I'll pull them up at the end, actually. So final thoughts. Basically, hopefully this gives you a little bit of an idea of what you can do to promote our basically keeping healthy and moving, so that you have some better lead-in-tos for exercise. These again are starting stages to be done at home. I thought about putting exercises on that had resistance bands, and I thought, wait a second, not everybody has resistance bands, so we should start simple. If you have further questions, I can always help with that at the end. But it's really important for you to keep moving. And if you have concerns, say you have atrial fib, or you had a stroke, or you had some other ailment, you're just not sure how to get started, that's where physical therapy can help. You first have to check in with your primary care or your orthopedic doc, but then we can help design what's safe for you. So every physical therapist knows about all the conditions that can affect you with exercise. And one of the things that affects every system in the body, whether it's the endocrine system, the neurosystem, the metabolic system, exercise affects it all. So we kind of have a little bit of information on all the systems. So you're not going to surprise us if you come in with an ailment that's not really common. We're used to adapting our exercises to fit your particular need. So don't hesitate, but if you are concerned and you don't know where to start, that's where it's a good place to start, is your primary care, and ask for physical therapy. Okay? Any questions?
So of your handouts?
So I can run over to the clinic if needed, or we can just post them.
And what we'll do, once we get more copies, is to put a set of those exercises on the website along with the recording of your talk.
Yeah.
Remember, everybody, it's oakmontsundayssymposium.org. Oakmont Sunday Symposium is all one word with no spaces. And then go to previous talks. And the talks usually come up by Tuesday or Wednesday, and we'll have copies of the exercises.
Go ahead, Sue.
I have a question. I was recently diagnosed with arthritis in my left foot, and I had a cortisone shot after a couple of weeks of pain and agony.
Mm-hmm.
And I haven't noticed it made a big difference. And you didn't mention cortisone in your presentation. What is the cure for arthritis in your feet?
So it's a great question. So that does fall into the injectable. So that's a steroid. Cortisone is the main common anti-inflammatory that they inject in. And so its whole job, again, is to just reduce that inflammation. So in some cases, that takes down the inflammation really successfully. And then again, your pain receptors are not being basically excited as much, and you can go about your business. But often you need to do some form of exercise or stretching to maintain in the feet. Sometimes it requires getting some over-the-counter orthotics. But in some cases, that inflammation just didn't get out as much as it could have. And unfortunately, in the foot, you are using it with every single step. So it might be that the arthritis is a little bit more advanced than what the cortisone injection could do. And that's what happens with those cortisone injections. They do have diminishing returns. So say you had a cortisone shot in your shoulder last year before you went on vacation and it did wonders, and you wanted to get another one this year, but it just didn't work so great. It's because you have less cartilage, less cushion this year than you did before. And that's just the normal part of aging. But at some point in time, the cortisone injections that used to be wonderful get a little less excitable, or they're just less helpful over time. And then eventually they kind of only work for a day or two.
Oh, thank you so much for this information. I've been dealing with Lyme disease initiated arthritis since 1980 and found the cortisone diminished in its return, and am interested in what dietary so we can have a long term rather than trying to, fix this with other things. Do you have any dietary suggestions?
So dietary is a challenge, mainly because people are not always good in the studies at following just what they're supposed to eat. So it's one of those really challenging things to study. But there are some anti-inflammatory diets, and you want to kind of consult with your physician on it. There's a few things that they're still looking at, like turmeric, to see if that helps reduce it. And for the most part, my scope doesn't really have things you ingest. I'm allowed to recommend topicals and encourage over the counters as long as you follow the directions on the bottle. But it's slightly out of my scope when it comes to dietary. So my best suggestion would be to ask your physician if he or she has any options for anti-inflammatory diet, and a nutritionist, unfortunately. But it is kind of not the best study because humans like to cheat when it comes to diets, including myself. I know.
So if you have back pain, is that just about cartilage, or is it also are the muscles also part involved?
Yeah, it's a little bit of both. So the cartilage is the cushion and the ligaments hold all the joints together. So the cartilage is this lovely little cushion here. And so when you have back pain, you might be feeling the fact that these cushions have gotten less cushy as we get older. And so the joints are getting a little closer. When it gets too close, it ends up pinching the nerves. And that sometimes when you get it in this lower part, that's where you get the sciatica. It's because the space between is now so narrow, your cushion is so thin that it's pinching on the nerve and giving you leg pain. And so that's what can happen. It's more, pain is usually associated with the cushion that's being lost. But also you could have a little bit of muscle soreness as you use them. So my best example is that first time in the spring when we go out and we try and figure out the garden after winter, and we feel all those muscles for the next few days. Whenever we stand up or move because we spent a day in the garden, that's more muscular, and it usually kind of subsides within 72 hours. That's delayed onset muscle soreness. The help for that is also ice, believe it or not. I know we all reach for the heating pad, but that is also an inflammatory disorder. So I would recommend ice on the back, even if it's muscle. And if it goes away in 72 hours, it was more than likely just that muscle, delayed onset muscle soreness. So it's kind of both. That answer your question a little better? So muscle soreness, again, is an anti-inflammatory process, or not anti-inflammatory, it is an inflammatory process. So when you've pushed the muscle a little beyond what it's used to, you get a little bit of inflammation. The fibers get a little bit what we call micro tearing, and that sets off an inflammatory cascade where your body then comes in, sets up healing for that. It takes about 3 days and then it subsides. The cool thing is that if you felt that your muscle got sore because you lifted a lot of water bottles or cases of wine or something, your muscle is going to actually respond by getting stronger. So if you felt that little bit of delayed onset muscle soreness for a few days, that's your body actually saying, hey, we got to get a little bit stronger in case she does this to me again in another few days. So I kind of think that muscle soreness is a good thing, and it should only last for about 3 days. Okay?
Yes, I've got a question about balance and falling. You as a gymnast know the issue about balance and sense of where you are in the air so that when you're going to trip, you will know you're going to fall. I watch Simone Biles. Well, she has this sense of where she is in the air. So she's going to land on her feet, or she's going to land in a safe way as possible. And in judo, it's the same thing. You learn how to fall and you spread your impact over your whole body or as much as you can. Are there exercises that you would recommend for developing or at least keeping a sense of the balance? I mean, you don't have to do front handsprings, but maybe the front roll. And then as far as the falling, the slapping the mat would be helpful. Are you, do you have any exercises that you would incorporate into a plan for people to
Yeah.
prevent
So
falling and then how to mitigate the fall?
yes. So falling and knowing your kinesthetic awareness is very important. Most athletes have a really good kinesthetic awareness, so they know how far they have to reach to catch that football. They know how far they have to slide to hit the base. Gymnasts know how narrow that beam is when they can't see because they're flipping. And so we all have some of that. Balance is actually 3 components of the human body. You have your visual input, which is very helpful until there's low lighting, or as we get older and our vision starts to fail. But that's one part of the brain that uses balance. You have your inner ear, which is the part that tells you when the elevator goes up or the car is accelerating and you don't have any visual input that you're going in a different direction. And then you have every single joint receptor and your skin have information, proprioception, that tells the brain, what's the surface like that I'm standing on? This is pretty flat, not grass. Got that figured out. I can balance. Or if a surface changes. So all 3 of those systems we use together every single day to balance. Unfortunately, as we get older, we kind of don't think about what our body is telling us as much, and we really start to rely just on the vision. So one of the things that you can do to help with your balance, and it sounds really, really simple, is actually just try every single day to stand on one foot for 30 seconds. If you get really good at it, stand next to something like a counter and try and do it with your eyes closed. When you do it with your eyes closed, you'll start to notice that your feet move a little bit more, your toes have to do more. And that's good because my brain is figuring out what I have to do to stay upright. Okay. So if that's too hard, try standing tandem and get used to just standing one foot in front of the other. Again, starting out with your arms out, arms in, arms by your sides up here, and then trying to do it with your eyes closed. Really simple, 30 seconds each leg. You could do it after you brush your teeth. And that's usually what I recommend. If you're too concerned, use the counter. Kitchen counters are fabulous because they're attached to the wall. So you can use your fingertips, and as you feel brave, try and see if you can hover, but I can still grab it if I need to. So that's what I usually recommend. That's very, very gentle. We don't have to worry about falling or rolling or anything like that. You're using the information to help you stay upright, which is what we want to do. Start listening to what our bodies are telling us and eventually trying not just to rely on the eyes. If you want an even bigger challenge, standing on that one foot and try turning your head. This challenges the inner ear because my ear is giving different information than what my foot's saying, and my eyes are having to figure out which way I'm going. And so again, standing next to something solid, first by yourself, then try and move. And it can be a really easy thing that you could do at home, and you don't have to worry about any equipment. And that's the safest way to start with balance. After that, if you're feeling really spunky, the fitness center has some wonderful balance things. They have a nice little toggle board over there with a stander. They have the half foam rollers that you can try and balance on like a gymnast. And they have the balance disc, the little bubble. It looks kind of like a whoopee cushion, but doesn't make any noise. And you can try and balance on that. So those are 3 things that you could do over the fitness center if you haven't experienced them. They're in the little stretching area over there by the inversion table. That can be very helpful. And just a few times a week. So yeah, balance is pretty easy. Also the Tai Chi, like I mentioned. So if you're wanting something more choreographed and more of a group setting, Tai Chi is great. There's lots of studies on Tai Chi and reducing fall risk that physical therapy encourages. And it's been around, gosh, 15, 20 years of literature has been out because I've been telling people for a while, trying to think back when I was out in Sebastopol. So before, sometime around 2010.
What is your thought about paraffin baths for either hand?
Therapin baths?
For either hand arthritis or foot arthritis.
I have one. They're great. So as I mentioned, I have foot arthritis. A Therapin bath is paraffin. It's a wax. You basically dip your hand or your foot. You can also do the elbow, but it kind of stops there because you have to fit the joint into the bath. So if you have elbow, hand, or foot arthritis, you dip it in 6 times, nice and slow, wrap it in a plastic bag and a towel, let it sit for 20 minutes, about actually 30 minutes, it starts to lose its heat. Then you peel it off and you go about doing your activities. What it does is a nice, gentle, warmth heat. It's kind of like a hot pack. But the thing that's nice about for the hand and the foot is that it engulfs it. So a heating pad works really well like on a knee or a back because it's more of a big surface, but our fingers, our wrists, and our feet have a lot more little divots and rounded areas. So it doesn't get as well wrapped up as a paraffin bath. And they have those usually at like Walgreens and Rite Aid around the winter time. I usually see them. They can be very effective. I have one, like I said, for my foot. I use it when I need to, usually in the winter time, and then go about my business.
Well, I don't know if this is going to work for me or not, but anyway, I wondered on your take what someone once told me, that if you can still get down on the floor every day and make sure that you know how to get up, whether you do that from just with using your own body or have to get like a corner where you brace your hands. Is that sound according to what you would go by?
Yeah. If you can get down, by all means, turn it into an exercise. It's a great fall recovery. And yeah, you might use furniture. So say you do fall, I know we're getting a little off topic, but say you do fall, what you want to do is figure out somehow, and I don't know if he can see me. I just realized I went to a spot that I don't think he can see me. Right here. I can get on the stage actually. Yeah, that works. I'll get on the stage. Then everybody can see. What a good thing I was a gymnast. So say you do fall and you're lying there for a little bit. Obviously, take a few seconds to kind of figure out, is everything okay? Take a moment. It's fine. If somebody offers you help, don't worry. Please take it because somebody can help you. And everybody's been through this, including myself. So don't worry about being embarrassed. But do take a few seconds to just kind of think, oh, my tailbone okay? Can I wiggle? Can I move? If you can, what you want to think about doing is trying to roll over onto your side. Doesn't matter which side, but you're going to try and roll over onto your side so that eventually you can try and get into what we call quadruped. Quadruped then allows you to pick whichever leg you feel is stronger to put in front and try then to stand up. Now, if you have something nearby like furniture that you can scoot towards or crawl towards, please do. You can use that to brace yourself like a coffee table, and then you're going to help push yourself up. If you don't have a coffee table or a chair, you can use your leg. Hopefully a person over here, you can hold their hand and you can push yourself up. Stronger leg's going to help you get up though. Okay. So again, trying to get onto your side, then onto hands and knees. If you need to scoot towards an item, then help yourself up. Hopefully that helps a little bit.
Sarina, I've been noticing you have a really pronounced lumbar curve, which is very important for back health. What do you recommend for those of us who have flat back at this stage? Is there anything that we can do for it?
So again, that exercise that I put on the front, where we're going side to side, that first exercise can be very helpful actually to help with your flexibility in your back, as well as pulling the knee to the chest, and then eventually both knees to the chest. That actually moves the joint in all directions, and that's going to be more safe than trying to do a bridge like a gymnast, which I don't recommend because then you end up pinching those nerves. So I don't usually encourage people to do a lot of this because as we get older, that sciatica starts to talk when we do this. And so it's better to just keep your natural spine curve and do the rotation as well as the flexion. Okay. That answer your question a little bit? I'm sorry.
Over here. So if someone has been diagnosed with osteoporosis, are these exercises that you've presented today appropriate?
Absolutely. Yeah. So these exercises are safe for people with osteoporosis or penia as well. That's a condition of the bones where they start to get more porous. None of these are impact exercises. They're all just stretches and strengthening. So yes, you can start with these. If you did have questions about increasing your bone health on the osteoporosis side of things, physical therapists can set up an exercise regimen that's safest for you. It's usually helpful if we know where your T-score was worse. So they usually look at your T-score for osteoporosis at the arm, the leg, or the back. If one of those is worse, the physical therapist usually designs exercises around that joint a little bit more. But all the exercises I put on here are safe to do. If you have osteopenia or porosis, they're not going to stress the joint at all.
Can you hear me?
I can, but I don't know if everybody else can.
Oh, okay. Sarina, does physical therapy here help with lower back pain?
I see a lot of it, yes.
Oh, okay. So I can call you guys up.
Yes.
Okay.
So lower back pain is usually a combination. It can be either the joint or it can be the muscles or it could be nerves, but physical therapy can help with any one of those to help mitigate it.
It's a desiccated disc.
So desiccated disc is a very nice way of saying that your arthritis has progressed to a point where you really don't have any more shock absorption in that area.
Okay.
So it's basically kind of squished to smithereens. Yeah.
So will it still help?
Yeah.
Okay.
Yeah. So usually we can't give you back the disc, but what we do try and encourage is your stomach muscles to help give you that space again, to give you a little bit of mitigation, and also keeping the flexibility within a reasonable amount. But yeah.
Okay.
Yeah, it's so desiccated disc, degenerative joint disease, spondyloarthritis, spinal stenosis. Those are all common terms for arthritis. So we all have a little bit of one of those.
Do we have any more questions for Sarina? Sarina, I want to thank you for absolutely wonderful presentation today to get us out of pain. We'd like to thank the Oakmont Fitness Club for sponsoring Sarina and bringing her out here again. We hope to see you again, by the way, Sarina. If you are interested in the fitness center, it's open like 360 days a week. It's open from 5 a.m. till 9, I think, except for one evening where it closes early for cleaning. And John Phillips is our trainer. If you are a member of the fitness club, you can visit with him 4 times a year and he can help you with your workouts. Thanks for coming to Sunday Symposium. We'll see you next week.